Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We are recording on February 13th, 2026. It's another emergency pod for President's Day to talk about the proposed changes to the ACA that were released last week. We have none other than Katie Keith. Katie, welcome back to the program.
Thanks so much. Nothing like an emergency podcast on Friday the 13th.
So when you were writing about this, because you have two pieces on Forefront that were released last week, we'll put a link to both of them in the show notes. Were you and all journalists required to use the word sweeping when it comes to these proposed changes?
Not required, no, but I think maybe we all had the same vibes. Okay,
fair enough. And we're going to get into what's the meat and the potatoes of what's in that proposed changes. But I did want to ask you, I know you've written for Health Affairs for a long time, a lot on the ACA. So I'm not sure when you started researching the ACA, but I guess I have a question just from a career perspective. Did you think you'd be really dissecting the ACA for this long?
Definitely not. It has been a gift and a joy to follow all the ins and outs. I will say it's been especially interesting. This rule, and one that we covered extensively on Forefront last year, it is a lot of the same policies that the Trump administration put in place the first time around. And so some of it is very new. Others are, I'm actually able to look back at what I wrote in 2018, for example. So we're sort of going back 6, 7, 8 years in time often to the recycled ideas. So again, some of it's new, a lot of it's not.
On that, we have this proposed rule that was released last week. It's 577 pages. I'm not going to read all of that, so that's why we have you here. What can you tell us about, from a numbers perspective?
Yeah, so I think the top line is 577-page proposed rule tells you about all you need to know in terms of the sweeping characterization that you're seeing everywhere, because this is an incredibly long proposed rule, certainly for the marketplace. It's also coming very, very late in the cycle. So normally it's an annual rule, but normally it comes in the winter, fall, and is sort of finalized by now. And this is, a big, sweeping, ambitious proposed rule. Comments are due March 13th, which is going to be really, really quick, given how much is in here and how big the impact of the rule could be. And then insurance companies and states normally kick off their plan process for next year beginning in May. And so it really, really puts a tight time frame on everything. And I don't know how stakeholders are going to respond so quickly. I don't know how this is going to play out in rates. And I think maybe the two other numbers I would highlight, which are somewhat related to the quick timing here, the administration's own estimates suggest up to 2 million people could lose coverage for 2027. And then there's a ton of stuff in here, which you'll hear me say probably more than once, but a lot of new sort of administrative burdens and, kind of new record keeping requirements up to $1.34 billion each year to implement. So if that gives anyone a sense of some of the stuff that's in here, lots of coverage losses, lots of administrative burden, lots of pages to read.
Yeah, so the comments are due March 11th. Is that correct, right?
It ended up, it's been updated to March 13th.
Okay. Sure. Why not? Okay. Well, let's get into what's actually in the bill. So a lot of what in my research looking into it, again, I didn't read all 577 pages, but a lot of focus has been talked about these catastrophic plans. What can you tell us?
Yeah. So at a high level, I think this rule signals that the administration seems to be prioritizing catastrophic plans. This seems to be the next big thing from what I can tell. And there's been a fair amount of focus on this as a coverage option, certainly now by the administration in this rule, but also Congress. And so there's kind of a wave happening here, if you will. At a high level, catastrophic plans, they're available through the marketplace. They cover the 10 essential health benefits, but they have very, very, very high deductibles. And you cannot use kind of premium tax credits or cost sharing credit. You don't get any financial help from the government when you enroll in them. And so because of that, we've seen actually very low enrollment nationwide. I think for last year, 54,000 people nationwide And that was compared to the 24.2 million people nationwide who enrolled in, bronze, silver, gold, platinum coverage, where, those plans you can use tax credits, and they have, more pre-deductible benefits and often lower out-of-pocket costs than what you'd find with a catastrophic plan. So when we say catastrophic, it is what it sounds like. It would really only cover the catastrophic costs you have, and you don't get coverage for anything other than preventive care or 3 primary care visits until you hit that really, really high deductible. And just so folks have the number in their head, it's about, for this year, it's, $10,600 you would have to spend before your insurance company kicks in to pay for your healthcare costs. So for a lot of people, that is just an exorbitant amount of money before your health insurance starts really working for you.
Yeah, I'm trying not to make this next question sound like a loaded question or a leading question, but I did, when you talk about affordability, I did have this thought, I know affordability is on the minds of a lot of people. I think it was mentioned in the press release for this proposed rule. Does this, and this is where it may sound leading, and I'm trying not to, does this create more of the illusion of affordability when it comes to this? If you get lower premiums and you're oh, okay, I can do that, and that I can purchase that, and then the reality of what you have to cost later down the line, is that a possibility of that illusion?
A possibility of an illusion, yes. No, I mean, premium, because the out-of-pocket costs are so much higher, premiums are lower for these plans in general. And so, if that is something that is attractive, I think these plans really only work for people who are healthy, though, because if you have any healthcare needs, you would have to pay that $10,600 before you get the care covered. For a family, it's even more, more than $20,000 to kick in. And so, a lot of people, typically are better off in a bronze or silver or gold or platinum because they can use the tax credits to help pull down premiums. So I think that's going to be one of the questions that I have about this policy is I don't know what the demand is for these, even if they have a lower premium, these super, super high deductible out-of-pocket plans. I just don't know. What you see from the research and polling and what we've just seen on the affordability fight with the enhanced premium tax credits for the Affordable Care Act is people want lower costs, they want lower premiums and lower deductibles and less complexity. And I think a product like this sort of, even if it gets you lower premiums, it's not going to get you those other things that I think people are looking for. And so I don't know how much this is going to drive or move the market. And, this is a question of if they expand it, will they come? And I'm not convinced that we will see people, fully migrate over to these catastrophic plans. The truth is it is an option for folks, but I think a lot of people would still be better off in bronze, silver, gold, plans that they can afford that have much better consumer protections.
So I guess what I'm getting to is do consumers know what they're purchasing on the ACA marketplace?
I think it's still very challenging for people to know. I mean, the marketplaces have come a long way in trying to make it clear. And, the whole goal of the marketplace was to enable consumers to have a one-stop shop where you could compare your options. And so I wouldn't say that it's impossible to do that. But I would say, I think we know people are very premium sensitive. And so if you are looking for the lowest premium option, it is extremely important for people to also understand what the sort of out-of-pocket cost implications could be. I think especially for one of these plans where they do not cover anything other than preventive care and primary care visits till you hit that deductible. And that would not be the case for some of the other, even plans with that have high deductibles, that would not be the case for those. So I think if this does get finalized, I think that will that consumer education is going to be hugely important so that people have full understanding of the product that they're enrolling in.
So in a KFF piece, you were quoted saying that this is the next big thing, catastrophic plans. So, from your perspective, you've been watching how regulations over the ACA has been changing or been attempted to change. Is this the next big thing? We used to talk about skinny plans. How much of an impact do you think this might have versus potential changes?
Yeah, and the truth is, I'm not sure how much of an impact it's going to have, and maybe I should say it's definitely going to be the next big thing, but I think the Trump administration is trying to make it the next big thing. It's like they're trying to make fetch happen, and I don't know if fetch is going to happen on this one, because I mean I said this already, but I don't know what the demand is for this product. I think people are looking for lower costs overall and better quality insurance that covers more of what people need. And that is not what a catastrophic plan will do. It might have a lower premium, but it's not going to meet those other needs. So I don't know if we're going to, again, 54,000 people last year. I just don't know if we're going to, even with all the flexibility that the Trump administration wants to give and expanded eligibility, they're really trying to clear a path for more people to enroll in these products. And I just don't know who is going to come. Maybe we will see an uptick in some ways, but I'm not convinced.
Well, for anyone wanting to learn more about the catastrophic plan changes, please go to the two forefront articles that we'll put into the show notes. Katie, also, that's not the only thing in the rule. There's a fair amount of plan changes where it comes to like network adequacy and standardized plans. What can you tell us about that?
Yeah, so this is one of those examples where there's a throwback happening to the first Trump administration. So this new rule would, over time, the federal government has been doing a lot more of this kind of plan review. So network adequacy is, making sure there's a sufficient number of providers in the network so that you can get the care that you need. It sort of is what it sounds like. You have an adequate plan network. And those reviews, the federal government has been, setting appointment time standards, time and distance standards, trying to really make sure that consumers have access to healthcare providers. This has been one of the criticisms of the Affordable Care Act for a long time, is that my doctor's not a network, or I can't, maybe get the appointment as quickly as I've needed. So there's been a ton of work going into that. What this rule would do is really stop enforcing those federal standards that have been honed over time and put this analysis back at state insurance departments or state exchanges. And so it's really kind of deferring back to state regulations where you'd see, a lot more variation, less of this sort of uniform standard. And, the truth is, I think some states have the resources and capacity to do a better job than others. And so I think, some people might have concerns that this is going to erode some of the, promising network adequacy standards that we've been seeing before. Another thing that they're changing, which is a throwback in that the first Trump administration tried to do this, was to eliminate standardized plan options. And so this was, something that the Obama and Biden administration really ramped up on. And the idea is to make it even. You asked a question about, do people know what they are getting? This was to make it easier to sort of compare one-to-one plans by having standard options. This rule would get rid of those and kind of allow, you'd still have, the tiers of bronze, gold, silver, but it would give insurance companies a lot more flexibility within those categories. They could do things like have co-insurance instead of flat co-payments. What it will require, I think, is for consumers to take another close look and really read the fine print and understand the details of what they're getting. The rule said about a third of folks had enrolled in one of these standardized plan options. And so those folks, the insurance companies could keep those, or those folks who are enrolled might have to go find a different plan.
Yeah, and historically, we are great at reading fine print as a society.
Especially insurance, yeah.
Well, as we wrap up, two last questions. Do you get a sense of like how the insurers have like reacted to this so far?
I'm not sure but I assume they are thinking about the timeline more than anything. That's what I would be thinking about if I was them. And, how quickly, especially some of these changes like catastrophic plans that could have implications for the rates that they want to set. I think insurance companies and states, frankly, need to know what the rules are so that they can price the products appropriately, so they can decide what they're going to put into the market and start to get ready. And having some really, I'll use the word sweeping again, proposal ideas out in February when this process kicks off in earnest in May, I think is going to be a real challenge. So I assume folks are going to look at this and maybe urge some delays from the Trump administration on this, where even if you're going to do this, can you at least hold off until 2028? But we'll see what happens.
Looking out even farther, we've seen some changes in the ACA subsidies. With this potential change, what do you see as the headline for 2026 for the ACA market in general?
Yeah, I mean, we've already started off in a bumpy year with the enhanced premium tax credits not being extended. And so what we know so far is that nationwide enrollment's down by more than 1 million people. I think we're going to see that number decline further as we get some additional data, probably here in March or April. I think as the One Big Beautiful Bill Act gets implemented, combined with some of the changes that are being proposed here, I think, it's going to be a lot of hurdles and barriers for consumers to jump through and to navigate to enroll in coverage and keep their coverage. And so I'm expecting, and this rule says as much or expects as much, that there's going to be more kind of coverage losses and frankly just higher costs for people. I think this is sort of going in the wrong direction in terms of holding consumers' costs down, where you'll be paying more in premiums and higher out-of-pocket costs as a result of some of these proposals.
Well, as in most things with health policy, time will tell. Katie, is there anything else that we haven't touched on that you think listeners should know about this rule?
No, I think I have some very long posts summarizing all the nitty-gritty details. By the time this pod comes out, there will be a third installment on everything else I haven't gotten to yet. So I'm happy reading and commenting to everyone who's listening.
Katie, thanks for joining us on this very special President's Day emergency pod. To you, the listener, if you enjoyed this episode, please send it to a friend and leave a review on Spotify. And with that, we'll see you later this week. Take care.